All right, we have all been there. We think we're sick, so we Google the symptoms. Then you go to the doctor saying, this is what I have. And you're wrong, usually, right? So that's why this morning we're talking about what doctors want you to know, what doctors want you to maybe not do. Dr. Sharon Thompson is here this morning because there's a lot of myths that go out there, a lot of things that you wish patients wouldn't do.
Absolutely. One of the big ones you laughed about a little bit and is the internet. The internet is wonderful. There's so much good information on the internet. Unfortunately, there's a lot of bad information on the internet, and there's no good way to tell you which applies to you and which doesn't. So I usually recommend people avoid scaring themselves or scaring their family members, and note what your symptoms are. So come to the doctor prepared with a good history of when the symptoms started, how severe it is, what makes it better, what makes it worse. But don't Google, because every symptom on Google, you could be a little bit warm and it'll say you have cancer, leukemia.
I'm so guilty of this. I will start typing in all my, I'm so guilty of it, or like, you know, but you're right. You scare yourself when you don't need to and let the expert figure that out.
Absolutely.
Right?
We get trained a long time to help you figure out what's going on.
I know a lot of people will come in saying, I need antibiotics. I need antibiotics, Dr. Thompson.
Yeah, this is another common one. And the problem is that people feel bad. When you have viruses, you feel terrible. You know, your head hurts, your nose is stuffy, you can't breathe, and you want relief. Unfortunately, we've, got a culture that says antibiotics will fix it. And unfortunately, most of the maladies that make us have those symptoms are viral, and antibiotics do not treat viruses. And we're having a growing problem in the country. Many of you have probably heard before about bacteria being resistant to antibiotics. That happens when we take antibiotics that we don't necessarily need. And so the bacteria in our bodies get exposed, and bacteria are very good at learning how to survive in the face of these medicines. So most times you don't need antibiotics. If your symptoms last more than 7 days, call your doctor and talk to them about it.
And again, it's all about finding out from the professional who's going to have a better idea of what you may have, or, obviously the right testing as well.
And we understand you want to feel better, but antibiotics are not a cure.
It's not always the answer. It's not always the answer. We like to think it's a quick fix, but it's not always that case. Let's go back to something you mentioned. When you do go into a doctor and you think you've already listed all your symptoms, family history is something you do want people to come in prepared with.
Absolutely. We can say that 400 times. Please talk to your families. And often families are very quiet. They're very reticent about telling you, what exactly the problem was. You may know that someone had a female problem, but families are not very detailed. And so you really have to sometimes lead the conversation to find out exactly who was it that had the issue and what exactly was the issue. And so I encourage people to have those conversations. We're heading into holiday season, right? All of them are coming up. Halloween and Thanksgiving and Christmas. These are times where families get together. So spend some time asking your family about their medical history, and maybe not fight about politics.
I like that one. Much better, much better.
A recommendation for a happy time.
Before we go, we also want to talk about mental health, because that also plays a role in so many things, especially these days, as we've seen.
Yes, and we talked about that recently, and it's a good one to revisit. Mental health is so important. It underlies everything: your appetite, your work performance, your physical health. So a lot of mental health conditions come along with aches, headaches, belly aches. So a lot of times people can think, oh, I'm allergic to gluten. And really, it might be a symptom of a mental health disorder. So you got to keep it top of mind and address your mental health. Critically important to your well-being.
All right. Dr. Thompson telling us what every doctor wishes they knew and their patients would do.
Yes.
So thank you so much for
Keep
that
you healthy.
advice. We always appreciate it.
You're welcome.